Rahim to go with abdominal aorta. This start from the aortic opening in the diaphragm at the level of T12, then continues downward till L4, T12, L1, L2, L3, L4. These all are posterior to it, and it ends in the terminal branches with right and left common iliac arteries. To go with the relations of abdominal aorta, we have anteriorly abdominal aorta is related to the celiac and aortic plexus of nerves, and body of pancreas, uncinate process, and third part of duodenum. Duodenum has four parts. The third part is the horizontal part lying. This one is the abdominal aorta passing behind the pancreas and the third part of duodenum. Posteriorly, it is related to four lumbar vertebrae L1, 2, 3 and 4. On the right side of it, it has inferior vena cava and cisterna chalae. Cisterna chalae is the lymphatic duct where all the lymphatics of the abdomen open, and also the beginning of azygous vein. Azygous vein is the continuation of cisterna chalae towards the thoracic cavity. On the left side, it is accompanying with the sympathetic chain, left sympathetic chain. To go with the branches of abdominal aorta, there are three anterior branches of abdominal aorta. Number one is the celiac trunk, number two is the superior mesenteric artery, and number three is the inferior mesenteric artery. Celiac trunk, superior mesenteric artery and inferior mesenteric artery. Celiac trunk is the branch of artery to the foregut. Superior mesenteric is the artery to the midgut, and inferior mesenteric artery is the artery to hindgut. The other branches are lateral visceral branches, the branches which arises laterally and supply some organ, like renal branches, right and left renal branches, right and left suprarenal branches. Suprarenal branches are of three types: superior, middle and inferior suprarenal, then renal, and then there is diaphragmatic या फिर phrenic branches, phrenic arteries, and then there are testicular or ovarian branches. These are the testicular or ovarian branches. Then there are lateral abdominal branches. Lateral abdominal branches are those that supplies the walls, abdominal muscles. These are first four lumbar arteries. These are there 1, 2, 3 and 4 lumbar arteries, and inferior phrenic also is the lateral abdominal wall branches. And then terminal branches are right and left common iliac branch and the median sacral branch.